Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments and when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 120,421 confirmed cases of COVID-19 in Canada and 40,194 cases in Ontario. Chatham-Kent has 330 cases and Sarnia-Lambton has reported 327 cases. Michigan now has 88,756 cases, with 13,015 cases being in Detroit. Today, we are reporting 2,402 cases of COVID-19 in our community, an increase of 9 cases from yesterday. 4 are local healthcare workers and 5 are in the community. 121 of our cases are currently active and are being followed by our health unit. 2,210 people have now resolved, 106 people are self-isolating, and 7 people are in the hospital. 26% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 65% are male and 35% are female. Our community has lost 71 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. 3 retirement homes are currently experiencing a COVID outbreak. In addition, there are 9 workplace outbreaks. 5 are in the agriculture sector, 4 are in the manufacturing sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain, if you're feeling confused or losing consciousness. Windsor-Essex has 2 COVID assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital, OLAT Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test results. To check your results, please go to wechu.org and click View Your Results to access the online test result portal. If you're unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us. The Windsor-Essex County region has faced a number of challenges in recent months related to COVID-19. As the last region in the province to move into Stage 3 of Ontario's reopening plan, it is very important for all of us to work together and carefully protect the careful progress we have made to date. The best way to protect children and those who work in schools as they return is to have and maintain a low burden of disease in our community. As a member of this community and a parent of 2 kids returning to the classroom myself, safe reopening of our school is personally important for me as well. Since we are the last region to move forward, we will have fewer weeks worth of information to build on, less time to ensure case counts remain low, and greater urgency to get the plan right. It is therefore critical that there would be a safe plan in place to enable our children and all of those who support them in our schools to return to classrooms safely. There needs to be a balance in how we make this happen. The Windsor-Essex County Health Unit supports children going back to school. Education is a basic building block of good public health, and we know that all of the things that go along with it, including socialization, teamwork, physical activity, and the trusted adults in the learning environment. These are all equally important to our children's development and well-being. As the Medical Officer of Health for Windsor-Essex, I'm recommending the following to make the return to school safe and healthy for everyone. Public health measures we have demonstrated are they're effective to be maintained in our schools, including number one, maintaining physical distancing wherever possible, at least 2 meters for classroom activities, providing instructions and frequent opportunities for staff, teachers, and children to clean their hands, encouraging the use of masks or face coverings in all indoor spaces with appropriate exceptions, even where it might not be mandatory, and providing education to staff and students about how to wear and maintain masks. That we consider safe options for transportation as well to and from school, including appropriate physical distancing measure on school buses, limiting students to one student or household per seat or those that are part of child's social circle, personal protective equipment for bus drivers and monitors, encouraging mask or face covering for all students using the bus, safely distance walking routes that consider traffic, crossings, and staggered arrival time for students, drop-off zones for students to safely exit vehicles and move into schools without congregating. Cleaning in schools continue to be the top of the mind and in line with the best practices recommendations from REACHU, which includes regular cleaning of high-touch surfaces, enabling students to clean their physical environment and teaching them about doing so in a safe manner, cleaning of classrooms, equipment, and spaces between uses. The complete picture of health and well-being for students and staff be considered with the lens of COVID-19, and this be inclusive of physical, mental, and emotional wellness. Providing clarity with a single adaptable plan for all school boards will help ensure the safety and well-being of all our children attending a public school system in our region. It is also important to highlight the role everyone in our community has to play in making the return to school safe. The safest thing for our children is for our community to have a low burden of disease. That means all of us doing our part by continuing to follow public health measures, including staying home when sick. Our complete guidance is included in Windsor-Essex County Health Unit's full safe return to school toolkit, which will be launched on our website today. The Windsor-Essex County Health Unit will continue to work with our school board partners, parents, and community as we gear up for children's safe return to school. The Windsor-Essex County Health Unit, through public health professionals, including public health nurses, will continue to support throughout the year as they implement, plan, adjust, and adopt to ensure a successful, healthy, and safe school year. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Any questions from CBC?
Yes, good morning, Dr. Ahmed. Just wanted to touch base. This week there's been a few cases among local healthcare workers. Any sort of insights into how that's happening?
Most of these healthcare workers are being picked up by asymptomatic surveillance testing that's been happening in each of these facilities. Very rarely, some of the healthcare workers are identified as a contact as well of other positives. So it's a combination of those two that's driving some of these numbers. But we are following up with all these retirement home and long-term care home workers to ensure that they continue to follow all the measures that are put in place since the COVID pandemic started. There is strong recommendations to ensure the safety and well-being of our vulnerable. And the threshold for declaring the outbreak in these facilities is obviously is very low, and we want to make sure that all the healthcare workers are taking all the precautions to ensure the safety and well-being of everyone. So it's just a part of that, and there's no significant trend that we have identified to say that maybe something is contributing to it. It's just a function of having all those things in place and picking up all these cases early.
Thanks, Dr. Ahmed. And looking ahead to back to school, how is the health unit going to handle outbreaks that happen at local schools?
So it really depends on a number of factors, and the key piece in any type of outbreak control, outbreak management, is to ensure the safety and well-being of the person who are who are positive, who are affected by it, and immediate control measures to put in place to prevent it from spreading it to others. In addition, we also would like to identify any of the close contacts that may have been in contact with the original case, whether we are talking about a case in a child or a case in a teacher. Having all those details would help us identify everyone who would be at risk. In most of the cases, in a cohorted classroom, it may include everyone in the classroom, or maybe a subsection of those classrooms. So again, it depends on the practices where everyone is wearing a mask, or maybe not all of them are wearing masks, or maybe some of them are wearing masks. So I think a number of factors will go into play, but generally speaking, it may include the entire class. And based on that information, we'll like to remove all those individuals in a timely manner to prevent any further spread to other classes or other grade schools. Once that happens, the other measures to ensure that cleaning and the environmental cleaning is happening before the room is ready for when the children can return to school. So I think there are a number of measures that will happen, and some of these guidelines will be very coming directly from the province. The school boards are also developing their own plan in terms of if a case is identified, what they will do in terms of getting the support from public health, or reaching out to parents and then informing whoever needs to pick up, or even like for symptoms. So I think there are all of these discussions are happening. We're working very closely with the school board to ensure that their plans aligns with our outbreak management plan. And some of these is also hinging on what the provincial guidelines will come down to us.
Thank you.
Any questions from AM 800?
Dr. Ahmed, speaking of the schools, so right now when we're in our bubble, it's 10 people or less for the close contacts. But now with kids going back to school, they'll be exposed to individuals outside of their bubble. So how will they still be able to communicate with people in their original bubble?
Well, I think even in the school when they're going in, we are trying to rely on the public health messaging that we've been talking about right from the beginning, and especially for higher grades, I think it would be easier to still try and restrict to their bubble, and even though that they can socially interact and be in the same classrooms, but recognizing that grade 4 and above will be wearing masks and maintain physical distancing. And even when we are making those recommendations for the classroom and the classroom sizes and everything, so I think we have to take into this factor that we are recommending that to maintain physical distancing. So having said that, yes, it would increase the number of exposure, but if all these measures are followed appropriately, they shouldn't get into that number of their close contact where they don't have to wear or follow any of these PPE measures. It definitely increases the risk, and that's why we want to make sure that we have all those things in place. And if followed appropriately, we hope that having all these mitigation measures in place will keep our children safe, and also identifying yourself as teachers, as parents, and being vigilant for any symptoms that you develop or your child develop, and keeping them safe at home. So it goes back a lot onto the prevention side. And to answer your question about the bubble piece, yes, it does increase the bubble, but having all these mitigation measures will help to mitigate some of those risks.
Do you think we're putting a lot of pressure on teachers, educators, and also the kids? Like, we were all kids once, we don't listen all the time. Like, this is going to be very challenging for everyone involved. Do you think there's a lot of pressure being put on the teachers, educators, school staff in general?
Well, I think it is different time. It is pandemic time, and I think it definitely puts everyone at an increased and heightened risks, heightened concern. As a parent, even just like you said, not two children are the same. Like one of my son can be very good and diligent in following everything. The other son may not necessarily follow everything that I am talking to him. So I think it really matters that children are children and they have their own way of doing things. It puts a lot of pressure on parents and and teachers. So I think we have to recognize that we're all in this together. We'll all have to do our part and support our teachers, support our parents, and support our children. Everyone needs some support, and we are working very closely with the school boards to make sure that they have a good system, good plan in place, and they feel comfortable with the plan and ensure that they have everything that they need to make this plan as part of their practice to ensure the safety and well-being of our children. So I agree that there's a lot of pressure on these teachers, but we all have to do our part to alleviate some of these concerns and ease off some of those pressures.
Thank you.
Any questions from Blackburn?
Yes, I wanted to ask you, Dr. Ahmed, we understand that the Public School Board has put its back-to-school plan on hold because of concerns about the potential for a COVID-19 outbreak. I understand that apparently a plan involving the school boards, the Ministry of Education, and the health unit are going to be released soon. Can you tell me what this plan would outline, aside from what you've already told us, and when that plan may come out?
Well, obviously, I don't have a timeline on when the ministry will release their detailed plan for outbreak management for public health and for the schools. So I don't have that date in my mind. But I think what we are talking about in terms of the planning pieces, it's obviously it's two-phased. One is happening at the school, and one that would happen through public health. And even in the absence of any strict plan, what I already told you, those are the measures that will continue to be in place. I think there will be more granularity in terms of what the roles and responsibilities and how it will actually happen, but the key principle will continue to stay the same. It won't be different. Isolating individuals, identifying cases, putting control measures, ensure the safety and well-being, that will be the key, whether we are talking about the plan in the school and plan for the health unit. And that should happen soon, recognizing that the clock is ticking and we don't have lots of time. And we want to make sure that all these prevention measures are in place, which would be the key in reducing any outbreak in a school setting. That is the key. And managing an outbreak is obviously something that would happen when it happens. But from a public health side, from a parent side, from a community side, I would be more inclined to make sure that we have all the right tools and measures in place in preventing any outbreak from happening in the first place.
As a parent and as a public health official, does it concern you that here we are 3 weeks out from school and the ministry hasn't come down with that yet?
Well, as I said, I was more focused on the prevention part, that if we didn't had any prevention guidelines, which we did, we have been working for a number of months now with the school board to make sure that they are working on this broad strategy, what it looks like in terms of cohorting, in terms of signage, in terms of ensuring that we have hand washing station, hand sanitizers, all those things, the screening piece, the education piece. So all those things are in place. I'm not entirely concerned about the outbreak piece, because maybe part of that is we are public health, we manage outbreak all the time, and managing if it ends up in having an outbreak in the school, we feel comfortable to manage it as well. We have managed other type of infectious diseases concerns in the schools as well. So it is not unique, it is not different. I think it just help us with some of the nuances that goes with COVID. And also, it may not necessarily be unique with for the school board as well, but I think I recognize, I respect everyone's concerns about having all these measures in place. But I think from a truly public health side, what I can say is focus more on the prevention side, and then if and when outbreak happens, we we've been managing outbreaks for like all the time. We have done that many times from a public health side, and we are working with the school boards. And the school board has already sent their preliminary draft of their outbreak plan. So we will be having those conversations this week, and hopefully we'll be able to provide some good feedback to them, and at least a local plan will be in place while we wait for the provincial document to come through.
Thank you.
Any questions from Winter Star?
Yes, good morning, Dr. Ahmed. The 4 new healthcare worker cases, am I right in believing that those are all the 4 new cases among workers at the retirement home where an outbreak has just been declared?
Yes, with the exception of one.
Okay, so three of the healthcare worker cases are at that retirement home, and then 1 is elsewhere?
Yes.
Okay, and those 3 workers at that retirement home, do you know yet, did they catch it from one another at work? Maybe did they spend time together outside of work?
I don't have that detail in front of me, Taylor. I'll have to get back to you on that.
Okay, no problem. And otherwise, I'm just wondering if you have a sense, or if maybe Teresa or Mike knows what time today we might see the plan on the Health Unit's website for the school toolkit.
It will be in the afternoon that I'm aware of, and we'll send out a notification, as we talked about, maybe a media release to go along with it, recognizing that this is a topic of interest for everyone. So we'll try to send out a media release or some kind of notification out to everyone.
Okay, and you're sort of alluding to the fact that public health manages outbreaks of other kinds of communicable diseases inside school regularly. So what kind of illnesses would you be managing in the school setting, COVID aside?
Well, chickenpox is a common one that we continue to see chickenpox cases in school settings. Thanks to the effort in vaccination with measles and all those type of vaccinations, so that helps us in preventing many of these things. But the plans to manage all of these outbreaks already exist, and we have been following those plans when we get to that concern that there are cases or there are children who were infectious while they were in school. So we have done that, and we continue to do that. So our plan for COVID will not be entirely different from what we've been doing, but obviously recognizing that COVID is there's more concern and anxiety associated with COVID. So we want to make sure that we have everything in place to utilize the best available evidence and work with everyone to ensure that everything is aligned and we keep our children safe.
Great. Thank you so much, Doctor.
Any questions from CTV?
Yes, thank you. Good morning, Doctor. I know that the toolkits will probably answer a lot of questions for families later on today, but I guess for your audience right now that are listening in or watching, what is your best advice to parents and families that are still on the fence about sending their kids to school?
Well, I think every child is different, as I said. So I think parents have to provide appropriate education to their child and recognize their unique needs and unique level of understanding, and make decisions appropriately. What I can say is having that education or back to school is important for their mental well-being, mental development, and many of the other associated activities that goes with children being in school. So all of those are important, and knowing and ensuring that the school board's plan to ensure the safety and well-being of our children is a top priority, and everything will continue to be monitored and updated and reviewed to keep that environment safe. A lot of effort has been put forward to ensure the safety and well-being of our children, and I do want everyone to review those plans, identify any of those concerns, have a discussion, have a conversation, and feel comfortable with it. Because we all have our different levels of anxiety, different levels of concern. So I would definitely encourage them to take that opportunity to review it, identify how it will be applicable to them and their children, And any concerns that they are identifying, I think those concerns, they should be connecting with the appropriate people to get those answers.
All right, thank you for that. And I hear through the grapevine that the Premier is coming to the area tomorrow. So I'm wondering, I know that you and your crew have worked really hard during this pandemic, and will there be an opportunity for you to meet up with Doug Ford at some point? Do you want to meet up with him at some point?
Well, I think as a region, it's great that Windsor-Essex has been in the forefront of the provincial government. For the region, it means a lot of things, including many of the economic activities, attention to the healthcare needs of our region, identifying the obviously I'm from the health, so I'll focus more on the health. Like our region is uniquely positioned with many unique challenges with respect to health. So having him in the region would help him and the province understand the unique challenges that we have seen, we have experienced, we have faced. It would be great that if we get an opportunity to explain some of those details from a public health perspective, and it would be beneficial for the region. But I don't know the complete plans, and if there is anything that he has set aside to meet with everyone in the region, recognizing that there are a lot of things that he want to cover, but it would be good if we can connect and maybe share some of our perspective, share some of our challenges, the unique challenges that we have seen throughout this pandemic.
Okay. Well, thanks for that, and yeah, I hope you get that chance tomorrow, because I know that St. Clair had the opportunity, but it slipped through their hands. So I think he's going somewhere else in terms of his visits, but hopefully you get that chance.
Any questions from Windsorite?
Good morning. The recommendations that you had read earlier from the health unit to the school boards, are those simply recommendations, or are you expecting the school boards to comply with these types of things? And would that turn into something like a Section 22 order if certain things weren't complied with?
So at this time, we've been working very closely with the school boards, and many of these recommendations are already there. They worked closely with us in developing all of their guidelines. And the recommendations that I put forward is a recommendation at this stage. I don't see that as being something that we want to enforce unless we see that there's a clear risk to the children. So I don't anticipate that happening, but we are working and we will work closely with the school board to see what additional measures is needed and how we can continue to support them based on the epidemiology, based on the cases that we'll see in the region. What are the other opportunities to strengthen it further? So we'll continue to have that dialogue, continue to work with them to ensure the safety and well-being of everyone.
Thank you.
Any further questions from CBC?
No, thank you.
AM 800?
Teresa, of the 7 cases in hospital, how many are in ICU?
There are 2 people that are in ICU of the 7 cases.
Okay, thank you.
Any further questions from
Blackburn?
Nope, I'm good.
Windsor Star?
No, thank you.
ATV?
All good, thank you.
Windsorite?
No, thanks.
Okay, take care, everyone.